Hello and welcome to today's Lunchtime Live. I'm Louise. I'm one of the clinical nurse specialists here at Breast Cancer Now, and I'm delighted to be joined by my colleague Jane. Do you want to say hi, Jane?
Hi, everybody.
So today's live is going to be sort of focused around the impact on sort of menopausal symptoms after breast cancer. And the reason we've chosen today's topic is it's World Menopause Awareness Day tomorrow. And I know for a lot of people that go through breast cancer treatment, there's been so much in the last few years around sort of menopause, HRT, and often that can make people feel even more isolated, because for most people, HRT is often not on the cards after a diagnosis of breast cancer. And so people often contact us around looking for ways to get support and information. So that hopefully will be the focus. So please feel free to put in questions, comments. It is a public forum, so just a reminder to be mindful if you want to discuss something that's quite private or intimate, then you can always give us a call on our helpline. Our helpline's open today until 4, and the number is 0808 800 6000. So do give us a call if you want to speak to one of our nurses. I think that's all the housekeeping I need to do today, but do feel free. We've got a couple of pre-submitted questions that we'll start with, and then hopefully we'll get some questions in that we can answer live. We're here for half an hour today just because it's a lunchtime one, so here till 1. Any questions we don't answer during the live, we will do our best to answer either later today or on Monday when we return to work after the weekend. So without further ado, Jane, do you want to ask the first question that we've had?
Yes, I suppose perhaps what would be most helpful, Lou, is if you wanted to explain about how breast cancer treatment can affect or impact on the menopause and the kind of menopausal symptoms that women can experience with their breast cancer treatment.
Yeah. So really important point, Jane. And I think also women, when they're diagnosed, can come at different starting points. So women who are post-menopausal could have already gone through the menopause, may well be on HRT, and when they get the diagnosis, could be told, or most of them are told, they need to stop that. So often they might have menopausal symptoms that are being controlled by HRT, and they get told to come off of that. So that can just bring those symptoms, hot flushes, night sweats, vaginal dryness back. Then you've got premenopausal women or perimenopausal women, so women who haven't been through menopause and still having their periods. And the treatments that they might be offered can impact on that. And that might be temporary or it might be permanent. So we know chemotherapy can impact. It can make people stop their periods, which can bring on some of the menopausal symptoms, which I'll go into in a minute. And again, for some women, chemotherapy may mean that their periods don't come back and don't return. But for others, it may be that it's just temporary, and it can take a good couple of years for periods for some people to return. So during that time, they may well be experiencing symptoms of menopause. And then we know for people who have got estrogen receptor positive breast cancer, a particular type of breast cancer, they will be recommended hormone therapy. And hormone therapy can either stop or block the production of estrogen. And it's done in different ways, whether or not you're sort of pre-menopausal or post-menopausal, and the different drugs. So there's aromatase inhibitors like letrozole, exemestane, and oh my God, my mind's gone blank then. Anastrozole. And tamoxifen. And so people can be offered these drugs generally for primary breast cancer after their treatment, and they can be recommended to be on those for 5 to 10 years. And the most common symptoms, side effects of hormone therapy is menopausal type symptoms. So hot flushes, night sweats, weight gain, joint and muscle aches and pains. So again, it's really... it can be really difficult for these women who maybe can't have HRT. How do they manage those symptoms when they're on long-term treatments like hormone therapies, where they could be on them for up to 10 years? I suppose just a quick mention about secondary breast cancer. Again, they can be given chemotherapy and hormone treatments, and they will be on them as long as they are, either for a course for chemotherapy, but for hormone therapies as long as they are working. So these are long-term treatments. And as I've already mentioned, there's a long list of side effects that people can get with menopausal type symptoms. And that can be, again, hot flushes, night sweats, vaginal dryness, increased UTIs, headaches, dizziness, brain fog, joint and muscle aches and pains, itchy skin. There's a long list. It can impact on sleep, mood. So again, it's really important that people know where they can go to get the right information and support.
Yeah, absolutely. And like you say, with these side effects, they can be to varying degrees, can't they? Some people might not be troubled really by them. That the treatment is quite manageable or tolerable. But for other women, we certainly hear on the helpline that these treatments can really impact on their quality of life. And it's always about balancing the benefits of these treatments in terms of reducing the risk of the cancer coming back. In terms of like hormone therapy, that's where it's prescribed, and so the benefits of it doing that, but also the drawbacks of the side effects. And we would encourage anyone that is sort of struggling with side effects to speak to their treatment team. But we'll come on to that in a little bit, won't we, Louise? We've got a range of information on our website, so do check our information out. There's lots of information on there, but what we could do is perhaps start with a couple of questions to get us started. And you sort of touched on hot flushes, which we know are the most commonly reported side effect of these types of therapies. So Zara has asked, thanks for your question, Zara. I'm really struggling with hot flushes. What are my options? As I've been told, I can't take HRT.
Yeah. And as I've sort of mentioned a few times, hot flushes are one of the most common side effects that people experience when they're going through sort of either menopause, whether that's naturally or due to treatments for breast cancer. And it can be really difficult because it can impact on sort of everyday life. It can make people feel sort of self-conscious when they're going through it. It can impact if they're going back to work. So it is really important. We've got information, as you say, Jane, we've got a booklet called Managing Menopausal Symptoms and Breast Cancer, or Menopausal Symptoms and Breast Cancer, which has got a whole range of options. And it can be really simple things, and there's no one size fits all, and it can be a bit of trial and error when people are going through sort of trying to manage these. So I think in the first instance, there's sort of lifestyle changes that people can consider. So it might be about keeping a diary to see if there's any particular triggers, whether it's food or drink that might do that. So it could be alcohol, which we know can make hot flushes sort of more severe, or the frequency of them increased. We also know that some particular, and caffeine as well can do that. We also know that some people find triggers such as spicy foods can be a trigger for them with their hot flushes. So I think it might be a starting point to see if you can pick up on what those triggers may well be. And then if you do, it might be about adapting certain things whilst also maintaining a balance, because it may well be that if you particularly like really spicy foods, that having that sort of on the odd occasion, so you're not completely removing it. Again, with alcohol, we know in addition to it reducing hot flushes, we know also that can reduce the chances, the risk of recurrence. So I think it's really important about finding that balance as well, but also helping if it helps with symptoms. The other things to consider is sort of lifestyle is we know that exercise can help, and maintaining a healthy weight as well. So they're sort of areas that you could possibly do yourself. If you found that you've tried those and they're not helping, then I think it's really important to either go back to your treatment team or your GP to sort of say, I've tried these sort of lifestyle changes. They're still there. They're still impacting on my quality of life. What can I do? And there's non-hormonal options that they may consider for you. And they are drugs that are often used in different scenarios. So we know that antidepressant drugs given in lower doses can be really effective for managing hot flushes. We also know that there's a class of drugs called anticonvulsants, but they can be used for sort of chronic pain as well. And gabapentin and pregabalin, again, given in different doses, can be really effective for hot flushes. There is other drugs as well. There's a drug called oxybutynin and clonidine. Now, with all of those, what people will often say, and we hear on the helpline, don't we, Jane, is that they come with their own side effects. So it's almost you're trying to balance something with a side effect you're getting from one tablet, and then you're giving me another tablet, and that might give me other side effects. So again, I wouldn't be too put off, because when they work for people, they work very well, and not everyone will get those side effects. But it's about maybe being open-minded to what the different options are. Cognitive behavioural therapy has been shown to be really effective for hot flushes, and there's specific cognitive behavioural therapy courses that breast care nurses or menopause specialists have been trained to do that can help with hot flushes. The Women's Health Concern has got a really good information leaflet about CBT for hot flushes on their website, which you can access. And there are resources, and there's studies have been done, in fact, looking at whether somebody does it as part of a in-person or virtual group-based cognitive behavioural therapy, or whether they just do it on their own. Actually, if you do it effectively, just reading through and managing that yourself, if you can do that, then actually they can both have the same effect. So that's the other thing. I think, just to mention, although we've said HRT is generally not on the cards for most people with breast cancer, if you've tried all of the options and it's really impacting on your quality of life, again, it's within conversations with your oncology teams or your breast treatment teams, and maybe a menopause specialist on those individual cases that may be considered around quality of life. Or the other thing is a treatment holiday from your hormone treatment, because sometimes it is just trying to work out what is the best thing, or a switch to a different hormone treatment.
Yeah,
is there anything else you'd like, Jane?
No, I was going to say there's a couple of newer drugs that are out, aren't they, that are looking at managing hot flushes. So fezolinetant is one of them, alendronidant is another, and these are the first drug, fezolinetant, has not been studied in women with breast cancer, but alendronidant, I can never say this, alendronidant has been. Not yet available on the NHS, but currently waiting for approval from NICE. So these are sort of non-hormone therapy drugs that are used to manage hot flushes.
Yeah, and I think that's a really exciting area, and hopefully, I mean, they're available on private prescription. Fezolinetant is only currently being studied at the moment in a trial for people with breast cancer, but the other one, which I'm not going to attempt to say as well, Jane, because I always get it mixed up. But hopefully, if they become NICE approved, that's another thing that we have sort of up our sleeves, really, to offer people that are not sort of suitable for systemic HRT.
Yeah, and we do hear from women that find different brands of hormone therapy can make a difference to their side effects, don't we? Because often that's more to do with what the drug is made up of. The essential, the drug itself is exactly the same in all brands. The sort of mechanism and action and what it's doing, but the other things that are used to make up that drug, so what they call the excipients, so the other kind of ingredients, if you like. Some people do find they struggle with one brand or are better on another brand. So again, it's worth keeping a note of that sort of thing. It can be difficult to get a specific brand. Sometimes it's a question of ringing around pharmacies, or your pharmacist might be able to help you with that. But yeah, we certainly know that brands can make a difference as well. Just on the back of the CBT, the cognitive behavioural therapy, Louise, Zoe said I'm currently having CBT and I found it very helpful. So yeah, just to kind of reinforce that lived experience that someone is saying that has helped them. So that's good to read. And also, I suppose it might be helpful to talk a bit about, so the next question that Jo has mentioned she's on letrozole and Zoladex. I have vaginal dryness, but don't want to bother my team. What can I do?
Yeah. And this is something I think we hear on the helpline. And I think two aspects to that about not bothering teams is we often hear people saying that their teams are really busy and they don't want to bother them. And absolutely. I mean, I was a breast care nurse. Both me and Jane have worked in the NHS previously. And I would always say that whilst we appreciate teams are busy, your concerns and symptoms are just as valid as when you were going through active treatment at the hospital. And I always used to say, patients, I'd much rather know, and I can signpost you, I can get you in, we can refer you on, than you sitting struggling with it at home. The other aspect to it is we know that conversations around sex, intimacy, vaginal dryness, these sorts of symptoms are harder to have, and maybe some healthcare professionals don't openly ask the right questions to get those answers. So I think it's really important, if you are struggling with that, again, that can really impact greatly on quality of life, not just feeling completely uncomfortable in everyday life, but it may also be impacting on your relationship with your partner if you've got a partner. And so it's really important that you access the right support, and you get that sort of, dealt with. And some of the things that we might talk through if you were to call us on the helpline is we know that vaginal moisturizers are really important as a first step. And almost sort of adding that to your everyday routine, and just making sure that sort of, that area is sort of kept moist. We know that with the estrogen deprivation down there, everything can become the layers, sort of the blood supply is lessened, the tissues can be much sort of more fragile, and that can lead to it feeling really sort of dry. And we have spoken to ladies where it's that painful that even not even doing exercise but walking can be really uncomfortable. So it is really important. So vaginal moisturizers, and also lubricants as well for sort of any sort of intimacy or sex as well. So that's really important. If you've tried those, we also know that pelvic floor exercises can be really important because they can encourage the blood flow and supply down there. The other thing is, if you've tried those, and I would say there's sort of, if you wanted to try them, there's some manufacturers, there's like Yes, Silk, I think Replens. It's trying to go with some, that are not sort of perfumed, have got not too many sort of nasty additives in them. But a lot of the manufacturers will send samples. So again, it might be that you just want to try some of those. You can get them on prescription if you find, once you've tried samples that work for you. If you've tried that and it doesn't, that's not effective, again, we know that vaginal estrogen may be suitable for some women. And again, the advice over the years has changed. When I was in practice, it was certainly something that it wasn't, but now we know that it's safe to give vaginal estrogen, particularly for those that are taking tamoxifen. There is still some research coming through, and I think the guidance is slowly changing. But I think for those people that are taking an aromatase inhibitor, so the likes of letrozole and anastrozole exemestane, it is a conversation, if you need to, around with your breast treatment team as to whether or not they would advise that you could have that. And again, it's talking about that very small sort of risk with the vaginal estrogen, because it can slightly impact on the effectiveness of the aromatase inhibitor. So it's a conversation to have with your treatment team. I mean, we would always say with all of these, it's really about talking to your treatment team with and having that joint conversation, either with a GP or menopause specialist.
Yeah, absolutely. And it looks like Wendy was prescribed HRT. Due to the risk of breast cancer, but I got it anyway, just had surgery, said it was estrogen fed. So it sounds like, Wendy, you do have a breast cancer diagnosis, but your treatment team have felt that it was appropriate. Again, taking into account drawbacks and benefits of HRT. That's just to sort of back that up again as well.
Yeah. And I think Wendy's also asked, do you stop producing
Yeah.
estrogen after menopause? And this is a really important question, isn't it? Because although your ovaries stop producing estrogen, you can still, estrogen can still be sort of, it gets converted within the fat cells. And I'm never great at explaining it in simple terms, but it's certainly, the ovaries no longer produce estrogen after you've gone through the menopause, but there still will be a certain amount of estrogen that gets converted within the fat cells into estrogen.
Yeah, it's just a lot lower amount as well, isn't it? It's not, obviously your ovaries are your main source of estrogen, and once you've passed the menopause, the ovaries, or if you have ovarian shutdown with treatment like Zoladex, or ovaries are removed, obviously then you'll be postmenopausal, so there will be no production of estrogen from the ovaries, but there is still a smaller amount that is produced by the fat cells. And Julia was asking about a treatment holiday. I mean, Julia's had a lobular breast cancer and is hormone positive. I mean, treatment holidays, it really depends on what your oncologist feels. Sometimes people might be off hormone therapy for a couple of months, would you say, Lou, just to see if there's a
Yeah,
difference
yeah.
to
I think
side
sort of 6
effects?
to 8 weeks generally is
Yeah,
what treatment teams will say. But others, I mean, we've spoken to ladies on the helpline where their treatment holidays have been slightly longer, and I think it's based on their individual
yeah,
features of their breast cancer and what
yeah.
what their team feels is the right thing for them.
Yeah, and it can also help establish, because some women might have a symptom, and it's difficult to actually pinpoint what it is. Is it the hormone therapy? Is it something else? Is it a natural aging thing? So by having that treatment holiday, you can either rule in or rule out that the hormone therapy was or wasn't causing that side effect or that symptom. So that can be helpful, in another way of, it can give other information that can be really helpful with managing whatever it is you're going through. So Julia, do have a chat with your treatment team if you are, if you think that would be of benefit to you. And I'll just say, so give us a ring on the helpline. That's probably the best thing with your query and question, 0808 800 6000, or email us at nurse@breastcancernow.org. So I suppose the other thing to think about is Sarah's asked about blood tests to establish menopausal status. Did you want to sort of touch a bit on blood tests to try and establish menopausal status? I know it's not necessarily
Yeah, I think, I mean,
straightforward.
how Sarah's sort of, no, she's ended hers. How reliable are these blood tests? And I
Yes.
think it's a really difficult one. I'm just reading Sarah's question. Just it's deciding which hormone therapy here is listed as I think, as I've not yet gone 12 months, and I think that's really tricky when you're in that situation. So Sarah's saying that she hadn't had not had a period for over 12 months, which technically that's how we sort of class somebody as being postmenopausal if they've not had a period for sort of just over that sort of 12-month mark. And I think you said at 10 months, and I think it's that real sort of grey area when they're deciding as to what. And I think, as I said before, the blood tests aren't always reliable. And if you've started on hormone treatment, then they would want to stop that hormone treatment again, because that would be influencing that. And you don't say how old you are, Sarah, but again, I think when you get to a certain age, it's usually over the age of 40, I think, again, these blood tests can be unreliable, particularly if you're in that perimenopausal stage, because there can be fluctuations. I think the bottom line is, and this is really to go back and possibly have a further discussion with your treatment team, but the particular treatment you're on, I know people often say, oh, well, the aromatase inhibitors are for postmenopausal women. I suppose it then is the discussion is if they feel that you're premenopausal, do they add in the Zoladex part, the ovarian suppression part to your hormone treatment, or do they just go with you being on an aromatase inhibitor? And I think that's got to be a discussion with your treatment team. Again, as Jane said about a previous question, you can always give us a ring, because it might be about sort of asking all of those sort of background questions that we can give a bit of a fuller discussion around that. The other thing to say, Sarah, is we do speakers lives, they're webinars, and we've got a speakers live coming up with a menopausal specialist who's embedded in a breast clinic, Alison Beth, and that's on the 12th of November. You can go on our website, put in speakers lives, and you can register to attend that. If you've registered and for whatever reason you can't attend live, they will send you the recording, but you wouldn't have been able to ask your question live during that session. But that's another signpost for further. But I would certainly say you need to sort of probably have a further discussion. It's not straightforward.
No, absolutely. And there is a different Sarah that's saying, my consultant does not want me to have a treatment holiday. He says my symptoms are not due to tamoxifen, don't know where to go. That's a bit unfortunate, Sarah, because if you don't mention what symptoms that you've got, and obviously you've gone to your treatment team to try and get help with sort of establishing a cause, and if your consultant's saying that it's not the tamoxifen, then I'm wondering what they're saying it could possibly be, or are there other tests that you need, obviously depending on what your symptoms are, to find out what the cause is, because it is important to get to the bottom of these things to try and help people move forward or live the best quality of life possible. So yeah, I think I don't know if your consultant, you can go back to them, speak to your GP. It does really depend on what symptoms you've got, I guess, and what's going on for you. But yeah, as with anybody, you're very welcome to give us a ring on the helpline. Or anything that we haven't covered. Anything else, Louise, that you would like to flag or signpost?
Just a couple of things, really. I mean, I know we've mentioned about our booklet, which has got a lot of the information around all of the options available for anyone who's struggling. Give our helpline a call if you want a written down answer. We've got our Ask Our Nurse service, our Moving Forward courses, and our Younger Women Together sort of touch on either sort of. Moving Forward definitely is for people with primary breast cancer who have sort of finished their hospital-based treatment within the last couple of years, and we do touch on sort of managing sort of ongoing symptoms, side effects. So menopause often comes through on that course. And for anyone under 45 who may be watching, we have Younger Women Together events, and our in-person and our online events, we do have sessions on managing menopausal symptoms as well. But also it's a chance to come together with other women who might be going through the same thing. So again, we've got a service called Someone Like Me, which is a peer support service for people with primary breast cancer, who you could be put in touch with somebody who's gone through similar treatment, similar age, who are trained to support you. They're a few years on. So again, it might be sort of talking through what worked for them, how they got particular support. There's an amazing organisation also called Menopause and Cancer. Danny Binnington is somebody who was diagnosed with breast cancer in her early 30s and really struggled with the support. So she does a whole host of she works with different organisations, works with us quite frequently. She's got a podcast and she has experts coming on asking sort of various things and talking through various things. So I would certainly do that as a signpost for additional support as well. And they've got a closed Facebook group for people that have been struggling with menopause after a cancer diagnosis. It's not breast cancer specific, but it's all types of cancer, but there is a large number on there who have had breast cancer.
Brilliant.
So I think we're nearing the end.
It's flown by, hasn't it, that half hour?
So thanks everyone for joining us this evening. Our next live is an Instagram live, which is next Thursday, the 23rd of October, which is around supporting younger women with our colleague Vic Kessel, who's got a guest speaker. And then on the 27th of October, we're back in on Facebook and we're talking about clinical trials for secondary breast cancer. So thank you everyone for joining us today. If we didn't manage to get to your question, we will answer. We'll send that as a written reply. But again, as I said right at the beginning, any questions, please do give us a call on the helpline. We're open till 4:00 today and we're open again tomorrow 9 till 1. Thanks all for joining.
Thanks everyone. Take care. Have a good weekend.